I first of all want to appreciate and acknowledge the presence of everyone. This is a very important event for us as a ministry, because we note the work that has been done by Kenya PHARMA through the support of the USAID. Indeed, it's something that will really go down in our books. What Kenya PHARMA has done is very commendable, strengthening our health systems, and more particularly in the supply chain and management, which has been noted to have been weak in a number of aspects. But again, we also take note that the functionality of our health systems really requires the availability of quality medicines. It is very important that availability of medicines is very pivotal for a functioning health systems. Of course, including other pillars. But more importantly, availability of modern commodities really determines access in our facilities. It really determines acceptability of services. It is not just the infrastructure, it's not just how the facility looks like, but again, commodities, and more particularly quality medicines, will determine whether people are really accessing services or not. And I want to give you an example. And what we have noted is that if the preventive services, especially coverage, where you do not witness the presence of essential commodities, we are not seeing, especially mothers who are bringing children for immunization, we are not seeing mothers, pregnant mothers coming for ANC, because they come to these facilities with other needs. And this is very important. What the Kenya PHARMA has done to ensuring that the ARVs and other related commodities are available, ensuring that utilization and coverages of our services have improved, as it is seen in the health indicators. So, ladies and gentlemen, I want to make the remarks by the Director of Medical Services. He would not have been with us today. He's had another official commitment, but he is with us here in the spirit. But I want to challenge KEMSA before I even make these remarks. I know you are inheriting a working program. You're not inheriting a moribund program. Kenya PHARMA has ensured that the supplies management system is actually not only working, but it's more efficient, it's more effective. I would want to challenge Dr. Monyo and his team, and with a very able chairman, that you are able to ensure that you not only maintain what Kenya PHARMA has been doing, but you'll also be able to extend this kind of support to include other commodities, not just the ARVs and others. So to Barbara Hughes, the Chief USAID Office of Health, Population and Nutrition, Ambassador Solomon Karancha, the Chairman KEMSA Board of Directors, Dr. Munyo, the CEO KEMSA, and the Vice President Chemonics East Africa, Ahmed Paul, and Ruth Joroge, the Chief of Party, Kenya PHARMA, the development partners who are in attendance, the head of NASCO, and other senior government officials who are present, distinguished guests, ladies and gentlemen. Good morning. It gives me great pleasure this morning to preside over a process that I helped kickstart more than 1 year ago, and also recognize the support that the U.S. government has provided to the government of Kenya. The U.S. government has supported the key government, Kenyan government to strengthen the health systems. And this support includes the acquisition of essential medicines and other health products, improving supply chains, and setting up information system that allows the country to make data-driven decisions and to improve the well-being of persons who are living with HIV. Ladies and gentlemen, commodity security remains one of the key pillars of our robust health systems. Over the years, tremendous achievements have been made in improving procurement systems and ensuring quality of products and improving distribution systems for HIV commodities. This has been made possible through collaborative efforts between the government and key stakeholders. The Ministry of Health has specifically supported improvements in the National Medicine Supply Chain Authority. For example, in 2009, when the Kenya PHARMA came on board, we had about over 208,000 patients who were on ART then. But through these collaborative efforts of NASCOP, KEMSA, and Kenya PHARMA, accessibility of ARVs and medicine for opportunistic infections has expanded. As of July this year, we had over 800,000 patients who are on ARV, out of which over 70,000 were children. These are tremendous gains, ladies and gentlemen, in the country's efforts to meet the 90 treatment targets by 2019. Today, we witness the official handover of USAID Kenya PHARMA project, a pharmaceutical supply chain project to two Ministry of Health institutions, KEMSA and NASCOP. This handover is a combination of many discussions and work sessions between the three organizations to ensure a seamless transition that guarantees that gains made in the last 6 years are maintained and improved. And that is why I was posing and requesting CEO KEMSA that this needs to be sustained. Ladies and gentlemen, most of us in this room can testify to the improvement in the pharmaceutical supply chain in Kenya as a result of contribution made by Kenya PHARMA. These range from running an efficient supply chain, introducing innovative tools like the electronic supply chain management system that allowed staff in the facilities to report and place orders, as well as enable them, decision makers, to have visibility of stocks available at the central point. Kenya PHARMA field officers also offered capacity building through on-job training and mentorship to facility staff on commodity management that has seen the quality of reports sent to the national level, as well as reporting rates greatly improved. And that's why I was saying, ladies and gentlemen, I think there are lessons learned in this kind of support that we need to replicate into the entire supply chain management system in order to introduce efficiency and effectiveness. I am also aware that the US government, through the USAID Kenya PHARMA project, has supported the two WHO pre-qualified laboratories in Kenya, that is MET and the National Quality Control Lab, with equipment and laboratory information management system valued at approximately $1.4 million US. This support goes a long way in helping the country fight against counterfeits and substandard medicines. It is often said that a country is as strong as its institutions. And it is on this premise that I have been very supportive of the transition of Kenya PHARMA project to our national institution of KEMSA and NASCOP. Ladies and gentlemen, I am aware that since April this year, that KEMSA has taken over the distribution of ARVs and medicines for opportunistic infections to facilities previously supplied by Kenya PHARMA. This is in addition to what KEMSA already does in ARV distribution and delivering essential medicines and other health products to counties. KEMSA and NASCOP have done extremely well, and I think we need to applaud KEMSA and NASCOP. I think this is the very time we have seen a collaboration, effective collaboration and partnership at work. And I think this needs to be emulated even in other programs, including even the nutrition commodities. So I am therefore confident that the two institutions will continue to outdo themselves in ensuring the commodity security is maintained for HIV services. The seamless handover is a clear indication that our institutions can deliver to international standards. And I challenge KEMSA and NASCOP to maintain the efficiency observed when the country to supply chains for ARVs. The government of Kenya therefore remains committed to supporting efficient and effective medicine supply chain system. To the US government, I want to express my deepest appreciation of your support, and I'm happy to note that you have extended the same level of funding to KEMSA to continue procuring ARVs and OI medicines. Ladies and gentlemen, it is now my pleasure to officially declare the USAID Kenya PHARMA project closed. Closed. It's closed, all right? But I'm glad that I'm meant to understand that we have our colleagues, visitors from the states who are here with us. But we are declaring now that project is closed. All right? Now we can look for something else. But again, also witness the handover of the project, pharmaceutical supply chain, the roles and responsibilities to KEMSA and NASCOP. I thank you. Thank you very much.